Hi, I'm Dr. Eti Ben-Shabbat from Brain Rehab Academy, and in this video I'd like to talk with you about the differences between small strokes compared to mini strokes or TIAs. This is the 5th video in my stroke series, and I think it's important to discuss these lesions because they present differently on brain images and also they require different things from you as a rehab clinician. By the end of this video, you'll be able to, 1, distinguish between small strokes versus mini strokes or TIAs. 2, you'll be able to know how they present themselves differently on brain images. And 3, you will know what you as a rehab clinician need to do about each one of them individually. Let's start by talking about the terminology of each one of them because it will help you understand how to distinguish between them. Small strokes usually refer to clinical presentation in which there are neurological symptoms that last for more than 24 hours. When people say mini strokes or TIAs, they use those two words synonymously. And what they actually mean is neurological symptoms that present themselves but resolve within 24 hours or even less. But these definitions are a little bit problematic because we know that some small strokes can also fully resolve. Perhaps not in 24 hours, but they can fully resolve. And sometimes if they are in locations, brain locations that doesn't have a very specific functional presentation, the person may not even know that they had a stroke. On the other hand, mini strokes or TIAs can have pathological presentation on brain images even quite a few days after the neurological symptoms have resolved. So they don't have that complete resolution that we tend to think about when we think about mini strokes or TIAs. In previous videos, I talked about the importance of perfusion imaging, CT scans, and MRIs for the diagnosis of stroke. Let's look at these modalities with regards to small strokes or mini strokes / TIAs. So let's start by talking about perfusion weighted imaging. Perfusion weighted imaging will be abnormal for small strokes, but CT scans will be difficult to identify on CT scans where the small stroke is. Now, you may not be able to identify it as a rehab clinician. Maybe even the radiologist won't be able to identify it. But if the radiologist was able to identify it, you're probably better off going to the radiologist and asking them to show you exactly where that lesion is. However, with small stroke, the best way to identify them is the diffusion weighted imaging of the MRIs. So in terms of the identifiers of small strokes, it's identifiable on perfusion imaging and diffusion weighted imaging in terms of MRIs. CT scans are very hard. It's very hard to identify the small strokes on CT scans. And another point that is important to note is that unlike large strokes, small strokes don't necessarily follow vascular territories, which means you'll see a small lesion somewhere and you wouldn't really know whether it's related to a vascular territory, which is why small strokes can be missed on images. Mini strokes or TIAs, on the other hand, may not have any presentation or pathological presentation or on brain imaging. If the images were done early and if those images are MRIs, in 50% of the cases you may see changes in diffusion weighted imaging and perfusion weighted imaging. In 30% of the cases, you will see changes after a week, which means that in those people, probably that was a small stroke that resolved in terms of symptoms, but remained pathological on brain imaging. What does this mean to you as a rehabilitation clinician? If it's a small stroke, it means that you should see evidence for it in the diffusion weighted imaging and the perfusion weighted imaging. If only CT scans were done and you can't see the lesion, but the clinical presentation suggests that it is a small stroke, perhaps it's a good idea for you to suggest to the neurologist or the rehabilitation physician that MRIs might be a good idea. If an MRI was taken and you're looking for this lesion and it wasn't reported in the radiology report, then you want to look for a small lesion somewhere that is not necessarily a vascular territory. In terms of what it means for treatment, if it's a small stroke, then you need to identify the structures that are affected, therefore the functions that are affected, and therefore the potential for recovery. Within the context of the team, that means secondary prevention to ensure that all the risk factors are addressed so the person is not going to get another stroke. In terms of TIAs, it means that you may see some changes in perfusion weighted imaging and diffusion weighted imaging, perhaps in the first few days or in the first week. If there was no MRIs done, then perhaps it's a good idea to recommend them if it's early enough. But at any rate, it means that this person is receiving a warning sign that a stroke is coming, and therefore you need to explain to them that it's really, really important that they address their risk factors to make sure they do not get a stroke. So you as a rehabilitation clinician need to be proactive, not just in terms of rehab, but also in terms of advocacy within the team. I want to give you an example of someone who I saw. It's someone who came from overseas and was complaining of neurological symptoms. So there was weakness and dragging of the foot and the arm as well. And when he had an MRI, the radiology report said that there was no lesion there. But when I looked at the images, I saw that there was a small lesion there. And so I had to liaise with a GP. So of course I continue treating the person, but I had to liaise with a GP to make sure that this person gets a referral to a neurologist, one, and two, that the risk factors are addressed to make sure he doesn't get another stroke. In summary, in this video I explained the differences between small strokes and mini strokes / TIAs. Now you know how to distinguish between them in terms of symptoms, but also how to distinguish between them on brain imaging. I hope you also understand now your role as a rehab clinician in treating small strokes and advocating to prevent or reduce the risk of having a stroke. If you found this useful, please share this video with other clinicians who you think may benefit from it. If you want to hear more about brain imaging and how to use it for rehab, subscribe to my channel, like, and please head to my website where you can find lots more information, as well as short and long courses. I'll see you in the next video.